Lines. My name is Caitlin. I'm a student from Incarnate Ward, and I'm here to do your eye and your ear assessment. Is that okay?
Yes.
Okay. Now, first, what I'm going to do is I'm going to check your eyes, see if there's symmetry, and check your pupils, check if there's any redness, check the conjunctiva, and see if it's not red or anything like that. Okay. Now, what I'm going to do is I'm going to check your, see if your pupils constrict, and check if they're equal bilaterally. Okay, good. Alright, now what I can do is I can check the Hirschberg, and I can put the bridge of the nose. You got good reflection on both sides, so that's good. I can check your cranial nerves, so can I have you follow the pen for me, please?
Mm-hmm.
Okay, good, perfect. Now what I can do is check the cranial nerves. Okay, I'm going to go ahead and check your red reflex. And also check your retina and the nerves and things like that. So I'm going to do. Okay, it looks good. I saw the red reflex. That means there's no brain damage or anything. Check the other side. Okay, it looks good. I saw her nerves. I didn't see any black spots or anything like that. Now, what I'm going to do is okay, I'm going to do the cover and cover, and can I have you cover up one eye and focus on one object, and as soon as you take your hand off, you'll still be focused. Okay, that's good. Your eye didn't wander or anything, and can I have you do the same? Focus on an object over there. Okay, thank you. Alright, good job. And that's it for the eyes. And now I'm going to go ahead and go to the ears. So I'm going to check. There's no drainage or anything coming out of her ears. I checked. She doesn't have like missing hair or anything like that. She doesn't have any lesions. So I'm going to go ahead and I'm going to check the tympanic membrane. Let me pull out. Alright, that's good. The tympanic membrane was pearly gray. So now I'm going to check the other ear. Alright, and it looks good. And we don't have any cover, so we're simulating. Next, I'm going to go ahead and check her hearing. So I'll come behind her and then come back, of course, a little bit further. But I'd whisper and see if she could repeat what I said.
Ellie, can you hear me?
So that's good. Next, I'm going to check the Weber, and I'm going to see if the sound goes away, both ears at the same time, and would you let me know if one goes away, if the sound goes away in one ear first?
It went away in both ears at the same time.
Okay, went away. Now I'm going to check the Renee, and what I'm going to do is I'm going to put it on your master board up there, and as soon as you don't hear it anymore, I'm going to move it to the front, and then you let me know when it goes away.
Okay. Okay. Okay.
Alright, and the air conduction should be 2 times longer than the bone conduction. Okay?
Mm-hmm.
And then that's it for the ears.
Alright, hello, my name is Courtney. I'm
Hello.
going to be your student nurse today. I'm going to be doing your abdominal assessment and your skin, hair, and nails. Is that all right with you?
Yes, ma'am.
Okay, if you could just lay down for me. I'm going to come around on this side. Okay. And we normally would have a drape over you here. And if this makes you feel uncomfortable or anything, just let me know. Okay, first I'm just going to inspect your stomach. I'm going to look for color or any like distension or any kind of protrusions or anything like that. I'm just going to be looking and feeling around, not quite yet, but just looking, and then I'm going to, and I see that everything's okay, so now I'm going to listen, and I'm going to listen in each quadrant, and I'm going to listen for about a minute, okay? And if I didn't hear any sounds, I'd listen for a full 5, but I'm just going to listen. Okay, and I did hear some peristalsis and all that stuff, and it was between 5 and 30, so you're okay, you're good. And then now, since I listened, also I'm going to listen beside the left of your umbilicus. I'm going to be listening for a bruit. So I'm going to use the other side of my stethoscope. And okay, so you're good. Alright, now, since I'm done like that, now I'm just going to be percussing a little bit. Your liver's on this side. I'm just going to kind of go into 9 sections, and I'm just going to be listening for sounds in Tiffany or sounds like a deeper sound, which means I'm over a mass or an organ or something like that. So. And if I heard a hardened sound over your liver, or if it was hard to hear anything or palpate, it would maybe be cirrhosis of the liver. Okay, so everything sounded good. Over the sides it sounded like timpani. Over some of the liver area it was more of a dull sound. So you're good. Now I'm just going to check your liver, and I'm going to usually start from your third intercostal space, but right for today I'm just going to start underneath your breast, and I'm going to start probably right around your umbilicus. So I'm going to start up here. Okay. Alright, and that's about where it is. It should be 6 to like 9 inches, 12 inches long, so you're good. And then, okay, so I'm done percussing. Now I'm just going to palpate. I'm going to start with a light palpation, just feeling for anything. Just let me know if you feel any kind of discomfort or pain. Do you have any kind of pain in your abdominal area? Okay. Alright. And now I'm just going to do a deeper palpation. I'm going to be looking for, organ placement or deeper masses. Just doing like a rocking motion. And I won't do it all the way. Okay. Alright, and you feel good. And then I'm just going to check for your bladder. You can kind of see, like right about here, you can feel, I don't think your bladder's full or anything like that. It's not distended, right? Okay. Okay, so you're good. Okay, if you could take a deep breath for me, I'm just going to feel your lower liver border. Okay, I can feel it. Alright, now I'm just going to come around here, and I'm going to sandwich your spleen, which is right about here, so if you can just take a deep breath for me. Okay, and I'm going to do your lower kidney. Good. One more time on this side. Okay. Your kidneys seem okay. Did you have any pain in your kidneys whenever I was doing that?
No.
Okay. Alright, now if you could just sit up for me really quick. And I'm just going to, okay, now I'm just going to hit. Do you feel any pain?
No.
Okay, if you can just lay back for me. Okay, and I forgot to mention, your liver was 4 to 6 inches, so it was healthy. I said the wrong number, so 4 to 6, so you're good. And I think that's everything. And also, I would feel for a thrill over the left of your umbilicus, and I don't feel anything. That'd be from your aorta. So, okay. And I think that's everything. Okay. All right. Now I'm going to be doing your skin, hair, and nail assessment. I'm just going to take a look at your nails, make sure that you have capillary refill. They look healthy. You have no clubbing or anything like that. They look good. Your skin is dry and cool. It's not overly moist or overly dry. It's good temperature. Your hair looks healthy and it looks dry and not brittle or anything like that, so you look like you have good hair. And your